right in here.
Dr. Joel Brook is passionate about feet and their impact on everyday lives. His medical practice, called Dallas Podiatry Works, is dedicated to that premise.
It's hard to ignore when your feet hurt. Something that hurts you with every step that you do really comes in the way of carrying out your activities of daily living. We see problems with skin, we see problems with musculoskeletal structures, we see nerve problems. A huge thing that we deal with is patients with diabetes and the complications that come from diabetic patients, and that's often the thing that gets the most press. But I really do a lot of musculoskeletal injuries. I deal with a lot of athletes, I deal with a lot of weekend warriors, I deal with just a lot of people who are having pains and strains and aches from either doing what they do every day or from exercising.
Also on that list, bunions.
Bunions are caused by muscle imbalances that are occurring in your feet. There is always a talk as to whether or not your shoes are causing your bunions or not. And I don't know that I can go there. It's my feeling that you're born with a function and structure of a certain foot type. You have a certain foot type. We see bunions in children, people who have not yet started to wear the types of shoes that you think would be associated with developing drifting of your toes. There are two parts to a bunion. The first part is that your big toe drifts outwards towards your little toe. But the thing that you can't see, that you need an x-ray to really demonstrate, is that first and second metatarsal bones, there's an increased distance between the first and second, where the first one drifts in as the great toe drifts out.
Dr. Brook, as you can see, is knowledgeable and easy to talk to. There's nothing intimidating here, as even his staff and other doctors will attest.
All right, so far so good. So we're seeing how that works.
Fantastic.
He takes care of my patients promptly. He gives very prompt feedback. He's been a fantastic colleague.
Dr. Brook is very caring, and he cares about his patients, and they come first, and he's just always there for them.
Now here's another typical Dr. Brook case.
Sometimes we can come and exactly put our finger on what's going on, and sometimes you can't. Not everything is diagnosed from an x-ray. It's often the thing that we point to because it gives us visual clues, but sometimes the biggest part of the diagnosis has to do with the history and the time that you spend with somebody determining what it is that brought them to the level of pain that they had, and had there been changes in what they had done, something that really elicited and brought that on. Shockwave therapy is great stuff. We use different wavelengths here, and we're able to treat musculoskeletal problems. The theory behind this is you take something that you've had for a long time, which is a chronic condition, and then you subject it to a controlled level of trauma with the use of shockwaves. It increases blood flow, it brings in healing factors. We have patients walk across an electronic force plate. It accurately analyzes the pressures that are going through certain parts of their foot during what we call the gait cycle, which is everything that happens during one step. The message that I want to get across is that foot pain is not normal. So much of what's out there that people just assume are things that you have to live with, you don't have to live with.